We start our presentation for today's topic, alternative therapeutic strategies for antibiotic resistant pathogens. Introduction to alternative therapeutic strategies. Antibiotic resistance poses a significant global health challenge, demanding innovative solutions beyond traditional antibiotics. Alternative therapeutic strategies are emerging as promising approaches to combat resistant pathogens. These include the use of bacteriophages, antimicrobial peptides, probiotics, immune modulation, and CRISPR based technologies. By targeting pathogens through novel mechanisms, these strategies aim to reduce reliance on conventional antibiotics and curb resistance development. Today, we explore the potential and progress of these alternatives in addressing this critical issue in modern medicine. Understanding the crisis of antibiotic resistance. Antibiotic resistance has emerged as a critical global health crisis, jeopardizing our ability to treat common infections and perform life saving medical procedures. Resistant pathogens lead to longer hospital stays, higher medical costs, and increased mortality rates, placing immense pressure on healthcare systems. Traditional antibiotics, once the cornerstone of infection management, are rapidly losing effectiveness due to overuse, misuse, and slow pace of new drug development. The limitations of these treatments highlight an urgent need for alternative strategies and innovative solutions to combat resistant bacteria and preserve the advances of modern medicine. This crisis demands immediate attention, multidisciplinary efforts, and sustainable practices to protect global health. Antibody therapies for targeting pathogens. Antibody therapies offer a targeted approach to combat infectious pathogens by leveraging monoclonal or polyclonal antibodies. These therapies neutralize toxins, inhibit pathogen adherence, or promote immune mediated clearance. The mechanism of action. Antibodies bind to specific antigens on pathogens or their toxins, preventing their harmful effects. They enhance phagocytosis, activate complement pathways, or block critical pathogen processes like adhesion or invasion. The notable therapies such as raxibacumab, a monoclonal antibody which acts against the Bacillus anthracis toxin approved for treating inhalation anthrax, and panobacumab, which targets Pseudomonas aeruginosa serotype 011, aiding in bacterial clearance and infection control. The challenges and limitation. Antibody therapies face challenges like high production costs, limited pathogen specificity, and reduced efficacy in immunocompromised patients. Additionally, the potential for resistance and the need for precise antigen identification can complicate development and widespread use. Exploring antimicrobial peptides and macrocycles as alternatives. Antimicrobial peptides and macrocycles are promising alternatives to traditional antibiotics, offering novel mechanisms to combat resistant pathogens. The mechanism of action over here is that antimicrobial peptides they disrupt the bacterial membranes through pore formation or membrane destabilization, leading to cell death. Macrocycle, including cyclic peptides, often inhibit essential bacterial enzymes or structural proteins. For example, colistin, a macrocyclic antimicrobial peptide that targets gram-negative bacteria by disrupting the outer membrane, particularly in multi-drug resistant infections. And muripavidine, a precision antimicrobial peptide targeting Pseudomonas aeruginosa outer membrane protecting BAM-A, essential for membrane assembly. The current challenges are that these therapies face challenges like toxicity, example nephrotoxicity with colistin, limited efficacy spectrum, high development costs, and potential resistance development. Overcoming these barriers requires further optimization and research. The rest of the presentation would be preceded by Ms. Noreena.
Okay. Proceeding further, phage therapy as a novel approach, leveraging phages to combat bacterial infections. On the overview, phages or bacteriophages are viruses that can specifically infect bacteria. They are highly targeted, leaving beneficial bacteria unharmed and are being explored as an alternative to antibiotics, especially for the drug-resistant infections. Their applications that they have several important applications such as phage therapy, safety, diagnostics, biotechnology, and also we can use it in environmental cleanup, in veterinary medicine, else in the agriculture. The key limitations of bacteriophage therapy are narrow host range. Phages are specific to certain bacterial strains, limiting their use in infections caused by diverse or unknown pathogens. Resistance development. Bacteria can evolve resistance to phages, making them less effective over time. Regularity and safety concerns. Phage therapy lacks standardized regulatory approval, raising concerns about safety, purity, and consistency in clinical use. Now proceeding further with the innovative use of antisense oligonucleotides. We can use them for precision targeting of bacterial genes. Like their mechanism of action is that they bind to the bacterial RNA through injecting their RNA through their tail, silencing specific genes necessary for survival or resistance. Their potential applications are they have broad spectrum applications by targeting conserved bacterial genes, including the specific silencing of resistance genes like NDM1 in E. coli bacteria. They also have some challenges like gram-negative bacteria possess an additional outer membrane composed of lipopolysaccharides, which serves as highly impermeable barrier due to which it restricts diffusion of large hydrophilic molecules, including antisense oligosaccharides. Now we can look at the different therapy types and also their positive and negative aspects. Like we will start with the antimicrobial peptides and macrocycles. They have the broad spectrum, high potency, but on the other hand, they have high toxicity and low selectivity. On the other hand, antibodies, if we look at their positive aspects, antibodies are highly specific to their targets and they can trigger immune response that can help infections or cancer. They are useful for targeting specific pathogens or molecules in the body. On the other hand, they also have some drawbacks, like their application is limited by the number of targets they can bind to, and they are often expensive due to complex manufacturing processes. The third one is bacteriophages. Their benefits are that they are highly targeted, attacking only specific bacteria and leaving beneficial microbes undisturbed. But on the other hand, they also have some drawbacks, like the narrow host range of bacteriophages can make them less versatile and bacteria can develop resistance over time, requiring constant adaptation of the phages used. The last one is antisense oligonucleotides. The antisense oligonucleotides provide highly specific gene targeting capabilities, allowing for the modulation of disease-causing genes at the RNA level, which can be indirectly precise and tailored to individual genetic variations. But they also have the drawback that the main challenges with ASOs and are their limited ability to efficiently enter cells and the difficulty in delivering them to right tissues, especially in the context of in vivo therapeutic use.
Future directions in antibiotic therapy. The key obstacles are that the challenges faced in antibiotic therapy include delivery mechanism, reducing toxicity, and ensuring broad applicability without compromising specificity.
The future concerns about the future research focus. Research efforts are directed towards developing robust delivery systems, improving diagnostics for targeted therapy, and optimizing combinations of therapies. We can look at the summary of this presentation. Some alternative therapies like phage-derived endolysins and AMPs may follow similar development paths to traditional antibiotics, while others will face unique challenges.
Now, we have discussed that the challenges and potential of alternative antimicrobial strategies in the face of rising antibiotic resistance, particularly in targeting gram-negative bacteria. Traditional antibiotics often target a broad spectrum of bacteria, but many new alternative strategies such as phage therapy, antimicrobial peptides, and antisense therapeutics show narrow spectrum activity. The progress of alternative approaches has been slow, with only a few advancing to clinical trials. Efforts to increase the effectiveness of antimicrobials, including enhancing small molecule entry, inhibiting drug efflux, and disrupting the bacteria membrane barrier.
Additionally, strategies like antibiotic adjuvants and antivirulence inhibitors and vaccines play a crucial role in combating resistance. Advances in technologies such as next generation sequencing and synthetic biology offer new opportunities to discover diverse antimicrobial compounds. Despite existing hurdles, these alternative approaches may lead to the next major breakthrough in antibiotic development, helping to address the looming threat of antibiotic resistance.
Thank you, and that's it from our end. We hope you have enjoyed our presentation and we appreciate your attention.
And thank you for listening to us.
Thank you so much. Thank you for your interesting report. Do you have some questions, guys?
Питання?
Huh? No. Okay. Hope to see you soon. Thank you so much.
We hope to see you soon, Professor.
Okay. Bye-bye.
Bye-bye.
Далі ми продовжуємо з доповіддю Оксани Зінченко, кандидатки біологічних наук, доцентки кафедри мікробіології, вірусології та біотехнології Одеського національного університету імені Мечникова. Тема доповіді антимікробна активність похідних нікотинової та ізонікотинової кислот. Оксано, доброго дня.
Доброго дня, чути мене?
Так, вас добре чути.
Так, чудово, я зараз спробую поділитися.
Дуже дякуємо, що ви доєдналися до нас.
Одну секундочку буквально.